what I think about when I think about the death from COVID is I think about that the patients are by themselves, and as a nurse, um, that is very traumatic. And I think as if I was working in the hospital, it would be very, very, very heartbreaking to have to be with my patients and their families not be able to be with them when they're passing from this earth.
It's hard for me to imagine where we are now with coronavirus. 100 years ago, we've never seen anything quite like this that has changed the whole impact of how we live our daily lives. So we have to look at that and make sure that we do everything we can to protect ourselves, protect our family, our friends, and our community. We want to get back to as normal a life as we can. And to do that, we have to get vaccinated.
It's been actually very surprising and encouraging on how many people have come to get vaccinated. So I do believe that it is realistic. I just think that we have to get the message out there, make young people understand that even though you're healthy and you can get the virus and you're going to be fine, but that may not be the same thing for your grandparent or for your neighbor or for someone who can't, they might actually not survive getting the disease. And so it's going to require those people getting vaccinated to protect those people.
The three different vaccines that we have are the Pfizer vaccine, the Moderna vaccine, and the Janssen vaccine. The Pfizer vaccine and the Moderna vaccine are mRNA vaccines, and they are 2-dose vaccines. The Janssen vaccine works a little bit differently, and it's a 1-dose vaccine. All three vaccines are authorized for use in the United States, and they've been authorized by the FDA. They're all safe and effective to prevent COVID-19 infection, and they also prevent serious illness of COVID-19, hospitalization, and death.
I got vaccinated for my family, my friends, my coworkers, my clients, and any others that I may be in contact with.
I have been a nurse for over 40 years, and I've worked in public health for 32 years. My heart is to make a difference, to help people in our communities, keep them safe and healthy. In that 32 years, I have never had the fear that I was not doing something that would keep our citizens safe. I do these things for my family and my friends, and I wouldn't do anything different for any other citizen in Oklahoma. We have to keep you safe. We do it every day. This is our job.
So something that is still being studied right now are the long haul symptoms. These are symptoms that don't stop after the short-term infection finishes. We're still studying these long haul symptoms, but some of these symptoms can include, difficulty catching your breath, or brain fog, or just things like that, where you don't quite feel like yourself even after the immediate infection is done. And another thing about the long haul symptoms is that we don't know how long these symptoms last. It can be for 6 months or even longer. And so this is another risk that we don't want people to take in getting or contracting COVID-19 infection.
One of the most effective ways for us to do this is to get vaccinated, one family at a time. Visit www.vaccinate.oklahoma.gov for more information, or contact your local pharmacy to see availability. A cleaner Muskogee, a better Muskogee, a healthy Muskogee.